Hello and welcome to BYJU'S Exam Prep IAS. Today's big news is the outbreak of the tomato flu that we are seeing specifically in the state of Kerala. But before we go deeper into this big news, there are a couple of important announcements. I hope all of you have been regularly following the Target Prelims 2022 crash course going live on our YouTube channel every evening at 7:30 p.m. Thousands of you have been turning up, answering those questions, and revising the entire syllabus of the UPSC examination. As you know, in this series, we have been discussing important subject wise current affairs of the past year and even the important current affairs of some time before that as well. Just a reminder, tomorrow's class at 7:30 pm will again be on environment and ecology. This will be part 3 of the same subject. So do join in for that as well at 7:30 pm. If you are not subscribed to the YouTube channel of BYJU'S IAS, do that right away and press the bell icon so that as soon as a live class begins, you will get a notification from our end. Also, BYJU'S is bringing to you another national scholarship test on 15th of May at 11 am. This test gives you a chance to win up to 90% scholarship on the BYJU'S IAS courses. All that you have to do is register for the test using the link given in the description of the video. The deadline to register for this test is 14th of May in the evening 6 pm. So do that right away. Now let's go back to our big news, which is about the outbreak of the tomato flu. Now, tomato flu is a viral disease that is mainly affecting children below the age of 5 years. The most specific symptoms of this disease that are being seen here include rashes, skin irritation, and dehydration. Now, a lot of reports have come in which have talked about the various symptoms that the patients are facing right now. They also include vomiting, nausea, joint pain, tiredness, diarrhea, runny nose, etc. So it's just like other forms of flu where you have these kind of symptoms such as vomiting, nausea, tiredness, fever, body ache, etc. The important part is that till now, there is no specific drug that has been designed for it. And that is why, as per the health experts, each and every symptom is being dealt with individually, separately, and hopefully the issue will resolve over time once the supportive care is given with respect to these particular issues that are being seen in the children. Now, the reason why it is in the news specifically is because Kerala has seen over 80 cases of tomato flu discovered in just the past few days, because of which the neighboring states, that is Tamil Nadu, Karnataka, etc., have also ramped up surveillance and they are now concerned specifically over the people entering their states from the state of Kerala. That is why the surveillance at the borders at Kerala, Tamil Nadu, and Kerala, Karnataka has been ramped up considerably. The experts say that the name tomato flu does not have anything to do with tomato, but it is because of the red blisters that the flu causes, specifically amongst the children. More than 80 children right now have been affected from the state of Kerala. Interestingly, all the confirmed cases of tomato flu have been only amongst the children below the age of 5 years, and that is why they are the ones who are seen to be most susceptible to this particular virus. As I said earlier, all the border states of Kerala now have been ramping up measures to undertake strict surveillance of people entering their state from Kerala. Since there is no medicine available for this particular disease, the experts have suggested a few things to be kept in mind. First and foremost, ensure cleanliness and hygiene to be maintained amongst the children. Also ensure that there is proper hydration provided to the patient. The patient should also immediately consult a doctor in case any of these symptoms surface. Now, this has not been found to be a deadly disease so far, but yes, it is affecting very, very small children, which can be a cause of concern for the families of those children. The infected children also should avoid scratching on these rashes because this will be an instinct that they would have. Whenever you have such kind of a thing in your hand and your legs, you want to scratch it out, but that will only make the situation worse. Also, maintain a clean surrounding, avoid contact with the infected people so that the disease does not spread. Karnataka Health Minister also has issued a statement saying that the people in the state do not need to panic. Yes, this is a very rare viral disease, but so far we do not have any signs which indicate that it is spreading to the nearby states of Kerala as well. This is it for today's big news. Thank you so much for watching the video.